Assalamu alaikum wa rahmatullahi wa barakatuh. This video belongs to King Abdulaziz University, Faculty of Medicine in Jeddah, Sulaimaniya branch, and in Rabat. The purpose of this video is to introduce and explain and demonstrate the neurological exam. There will be a sequence or a number of videos containing the various components of the neurological exam. In neurology, the exam is relatively longer than other specialties, and the purpose of that is to localize the lesion, which is different from any other specialty where you usually just simply go ahead and look at the diagnosis. In neurology, you ask yourself where the lesion is in the nervous system, if there's a lesion, that is, and then you ask yourself where in the nervous system that lesion might be, in the central nervous system or in the peripheral nervous system. And if it's in the central nervous system, is it high in the cortex, in the subcortical area, in the brainstem, or in the spinal cord? And if it's in the peripheral nervous system, it's either in the anterior horn cell downwards to the nerve roots, the plexus, the nerves themselves, the nerve endings, the neuromuscular junction, or the muscle. Or otherwise it could be in the peripheral sensory system. We will start by the higher mental functions, which is the first component of the exam, go on to the cranial nerves, the second component of the exam, and then the motor system, followed by the sensory system, and then the cerebellar exam and coordination. So that's the first. So on to the first component of the neurological exam, and one of its most important and most commonly done parts, not just by neurologists, but it's also important in other areas in medicine and surgery, and really important for every physician, which is higher mental functions. People often tend to think of higher mental functions as being a global sort of one entity, whereas in fact higher mental functions are several functions or domains of functioning. So we are going to go through them one after the other and provide some explanation and demonstrate the testing. Over here, Yusuf is one of our bright medical students, and he's agreed to participate in helping us demonstrate the examination. Thank you, Yusuf. So the first component we're going to talk about is wakefulness and arousal. Each time a neurologist or a physician wants to examine their patient, they are supposed to start by thinking about their level of wakefulness and the level of arousal, because it affects all of the other higher mental functions and cognitive capacities, and really the neurological examination in general. And if there is coma, for example, one is able to test very little in terms of cognition. Luckily, Yusuf here is not in coma, so I'm able to observe and describe his wakefulness and arousal. And really, observation and description is the most important part of testing wakefulness and arousal. So for example, I'm able to observe that Yusuf has his eyes open spontaneously and blinking naturally, as compared to someone who might be in bed in coma, whose eyes might be either closed and they might not even open with verbal or painful stimulation. And so eyes is the first thing people might want to look at. And then verbal responses. So first of all, Yusuf was just talking to me. Are you awake, Yusuf? So he's verbally reciprocating conversation spontaneously and easily, as opposed to someone who might be delirious or in coma, whose reciprocation of conversation might be affected. So people in coma do not talk, do not produce any verbal output, not spontaneously. Later levels of coma will produce verbal output with verbal stimulation, loud voices, if you call their names loudly. So if right now I'm just going to call Yusuf and say, Yusuf, say hi, and he's going to say hi. or say Assalamu alaikum, he's going to say Assalamu alaikum. Someone at bedside, you're going to go and you're going to have to yell his name louder and louder and trying to get a response. And if that doesn't work, people try to inflict painful stimulation, which is by rubbing the chest of the patient or the orbital ridge of the patient, for example, and try to see if we can elicit either a verbal response or really any response of any sort. The third component after the verbal output is the motor situation, meaning the person's motor behavior, both spontaneous and to commands and to stimulation. So Yusuf is sitting here comfortably with what we expect of him in terms of posture. He's moving spontaneously and purposefully. If someone is in coma or with a reduced level of consciousness, one wants to comment on this level. These components are akin to what the components of a Glasgow's coma scale are. So people will want to go and look at those and memorize those. The Glasgow's coma scale is a scoring scale out of 15, but really the number is not the most important part. As I mentioned earlier, I want to emphasize that observing and describing is the most important part for the neurological purposes, both for really conveying what you are seeing on examination to the listener or reader, and for the purposes of follow-up, let alone diagnosis. So after you move on, beyond wakefulness and arousal, we move on to attention. So attention is the brain's ability to focus its cognitive capacities towards a specific set of stimuli. And there are multiple ways to test attention. The most commonly used way in the medical floors is to walk in and say, يوسف كيف حالك؟
الحمد لله.
أنت عارف أنت فين؟
في مستشفى جامعة الملك عبد العزيز
في أي دور؟
في البيسمنت.
أوكي، إيش اسم المكان اللي إحنا فيه؟
مختبر ال AEG.
مظبوط، مختبر ال EEG وال EMG. الساعة كم الحين تقريبا؟
تقريبا الساعة 10:15.
10:15 صباحا ولا مساء؟
صباحا.
كويس، أنت تمام. طيب، وأنا مين؟
دكتور هيثم طيب.
مين كان يدوم في الغرفة؟ في ناس آخرين؟
كان في أستاذ أبرار بدويان، كان في ممرض.
So by this we are able to demonstrate that Yusuf is oriented to time, place, and person. And this is an essential function. It's really not just a test of attention, it's a test of memory. But this information, orientation to time, place, and person, is something that we update in our memory regularly, and this requires attention. So it's an indirect test of attention. Or in other words, it's not a pure test of attention, but it's a very quick test of attention. When someone is ill, when they're delirious from a urinary tract infection, from a pneumonia, from intoxication, from one of any of a long list of causes, they might start to lose or they have a deficit in attention and therefore will not update this information. So they might lose track of where they are. They might not know exactly what time it is, and so on and so forth. A pure test of attention, and a more formal way to test attention, is digit span, which we will demonstrate shortly. So I just demonstrated orientation, which can be thought of as a test of attention, and it's practical. The next test I'm going to demonstrate is the digit span, which is the person's ability to hold series of numbers in their brain and repeat them quickly. So let's demonstrate that. So يوسف هقول لك أنا أرقام ولما أخلص عيد لي هي على طول. جميل؟ فمثلا لو قلت 1 2 3 هديك الإشارة هتقول 1 2 3. جميل؟ والأرقام حتزيد في البداية، حتبدأ برقمين بعدين حتزيد تصير 3 و4 والله تشحذ انتباهك. ماشي؟ فنقول ورايا 9 4
9 4
8 5 7
8 5 7
6 2 9 1 5
6 2 9 1 5
6 1 7 9 6 5.
6 1 7 9 1 5.
And so Yusuf made a slight error. So the person will have repeated the digit span correctly if they give it back to you in time and in the correct sequence and without missing any digits. So we reached up to 5 and it was very easy for him. And 5 is a rule of thumb is that a digit span of 5 is usually the least accepted number of digits that can be passed as normal. And I'm sure Yusuf's digit span is longer than that. So let's try again. 9 4 7 3 9 1.
9 4 7 3 4 1.
So Yusuf again made another slight mistake. So let's try it one more time. So obviously this does not mean that Yusuf is delirious. Obviously, I don't think so. But attention is affected by a number of causes. One of them is simply performance anxiety. So anxiety distracts people. And it's very common for any of us to feel that they're less attentive when they're anxious. In addition, psychiatric conditions affect attention. Delirium is the reason that's most commonly seen as affecting attention in the medical floors, for example. His attention is strictly normal. But if it's true that 5 is the lower limit of normal, but you'd expect higher in people who are higher in education and higher in mental capacities. So people who are, for example, illiterate, you would lower your expectations. People who are highly educated, you would raise your expectations. So let's try it yet one more time. خلينا نسوي بالعربي. 6 3 8 5 2 1.
6 3 8 5 2 1.
كمان مرة. 7 4 1 3 2 5 1.
7 3 2 5 4 1.
Yeah, I'm sure if we persisted, we would be able to get Yusuf to a digit span of 7 and more. But I guess the concept is demonstrated. So if you go to someone in the medical floor and you try this test and they only are able to repeat 2 or 3 or 4 digits forward, then that's abnormal, and it indicates that it might be a problem of simple attention. So moving on from a digit span, a third test of attention is serial 7s. Or again, it's commonly used, and it's again not a pure test of attention because it applies calculation as well. So Yusuf, أبدأ من 100 ونقص 7 وبعدين من الناتج نقص 7 وأنزل 7.
100 93 86 79 72 65.
Jimmy. So Yusuf did this very easily, and people with slight problems with attention might have difficulties with this, or people with acalculia or difficulties with calculation. And so this is attention. This is how people test attention, and I would like to emphasize that testing attention is very important for the not just neurologist, but also for the psychiatrist, the internist, the surgeon, the general physician. You need to test attention in every single patient of yours, and you do that sometimes indirectly, but doing it formally when you have suspicion that your patient might be inattentive or sick is important, because it might be your earliest signs of a medical problem. So we can move on to the next component, which is language. So language is composed of several aspects. One of them is fluency. So يوسف قل لنا كيف الدراسة في كلية الطب؟
الدراسة في كلية الطب تجربة جميلة أي طالب يمر بها يمر بضغوطات حطها عليه المجتمع، لكن لما يمشي في الكلية يجد أن الدراسة أسهل مما قيل له.
Good, and you sometimes have fun by participating in things like this. So the fluency is the ease of word output, and it's measured by the number of words per minute. So Yusuf was very easily able to generate an appropriate sentence or a group of sentences without hesitation. And it tells me that the anterior system in his brain, the anterior language system in his brain is functioning properly. People with Broca's aphasia, people who have lesions in the anterior part of the language system, will have difficulties with fluency, meaning they will have a lot of pauses between words, they will hesitate, at the extremes of cases they might not say anything, or they will only be able to say one word after a long pause. So this is what fluency is, the ease of word output. The other big component of language is comprehension. The person's ability to understand what is being said to him or her. And it's tested like this. يوسف غمض عينك. افتح عينك. ارفع يدينك من فوق. So very simple commands بننزلهم. Very simple commands, whether or not he's able to obey them. And sometimes even people with language problems will have no problem obeying these things. So you escalate to more difficult commands. يوسف بيدك اليمين المس اذنك اليسار. So we're crossing midline. وبيدك اليسار المس اذنك اليمين. Again, we're crossing midline. أشر على الأرض بعدين أشر على السقف. So sequences. طيب أشر على الباب بس لكن بعد ما تكون قلك أشرت لي على واحد من اللمبات في الغرفة. So there was a switch there. I told him to do something and then distracted him by telling him that he needs to do something else first. The other thing you can do is you can use passive or indirect sentence structure. For example, يوسف لو كان في أسد ووحيد قرن في الغابة وصار بينهم معركة والأسد انهزم من وحيد القرن وانقتل، مين لسه عايش؟
وحيد القرن.
وحيد القرن. So some people with slight difficulties in comprehension that sort of creep in might have difficulty understanding passive structure, but at the bedside you want to use the things we demonstrated earlier. So the first start with the midline commands, very simple commands, go on to multi-step commands, commands that cross the midline, commands with switches in order, and then you can move on to passive structure. The other component, the third component in language, so we talked about fluency and comprehension. The third component is repetition. يوسف ردد ورايا بلح تعلق تحت قلعة حلب.
بلح تعلق تحت قلعة حلب.
So some people with specific types of aphasias, with specific disorders in the language system, will have difficulty in repetition only, or difficulty with repetition along with other kinds of difficulties. So repetition is the third component of language testing. So you just simply tell the patient a relatively long sentence to use, to repeat, just like the one I just used. The fourth component of language is naming. So you just ask the patient to name things. So يوسف إيش هذه؟ قميص. وهذا إيش هو؟
هذا إزرار.
إزرار. وهذا إيش سموه؟
هذه بطاقة.
بطاقة. وهذا إيش هو؟
هذا قلم.
جميل. وهذه إيش هي؟
مطرقة.
جميل. وهذه إيش هي؟
هذه مسامير.
Just to demonstrate. So you find, you start with وهذا إيش هو؟
مايكروفون.
So وهذا الجزء النووي إيش يسموه؟
يسموه الياقة. ما أعرف يسموه.
So obviously, naming is affected by cultural and prior knowledge. So if you are not aware that this is أنا هنقول عليكم أحيانا كثير. وهذا إيش؟
هل
هذا الياقة. وهذا إيش يسموه؟
هذا الكبك.
هذا الكبر. وهذا إيش يسموها؟
كرافتة.
So you don't just use frequent nouns. So almost everybody will be able to name the pen, for example. But what إيش نوع القلم هذا بالذات؟ إيش يسموه؟ قلم
حبر.
قلم حبر ولا قلم؟ في ناس كثير يسموه قلم جاف. So بالإنجليزي يسموه؟
Drying.
Ball pen. So you look for parts of objects, types of objects, because sometimes people will have ease and no problem naming common, frequently used nouns, but will have difficulty naming parts of objects. So we talked about fluency, comprehension, repetition, naming, and then the other two components that you should do if you want to do a complete language exam is reading and writing. But we will not demonstrate them for the purposes of this video. So moving on from language, so we have already demonstrated wakefulness and arousal, next to attention, and then language, and now we're up to memory. So there are multiple types of memory, a number of different types of tests to scrutinize memory, but the test that is most helpful perhaps in the most helpful formal test is to give the person in front of you 3 words or 5 words if you want to make it harder, if you expect them to remember 5 words, and you distract them and then you ask them to give it back to you later on. So يوسف أنا هقول لك 5 كلمات وباك تحفظها، ما هقول لك هخليك تعيد اللي هي، بس أنا باك تحفظها عشان حسألك عنها بعد فترة، بعد عدة دقائق. الكلمات هي أذن، قطن، مستشفى، مدرسة، شجاعة. إيش الكلمات؟
أذن، قطن، مستشفى، مدرسة، شجاعة.
So repeating the words is a test of attention, obviously. It's just like the digit span, but it's with words, and it uses language. So مرة ثانية كررها.
أذن، قطن، مستشفى، مدرسة، شجاعة.
جميل. مرة ثالثة.
أذن، قطن، مستشفى، مدرسة، شجاعة.
And the purpose of having the person repeat it multiple times is to make sure that they've memorized it, that they've registered it, that they have encoded it in their brain, so that it's not fair to give them the words and then ask them for it later when they did not actually memorize it. So Yusuf, me and Nagus 17 كم؟
83.
و ننقص كمان 17 من 83.
66.
جميل. طيب كلمة السعودية تهجأ هي؟
ألف لام سين عين واو دال ياء تاء مربوطة.
تهجأ بالعكس.
تاء مربوطة ياء واو عين سين لام ألف.
كلمة المملكة تهجأ بالعكس.
تاء مربوطة كاف لام ميم ميم لام ألف.
جميل. حقول لك رقم وبعدين حقول لك سيريز الأرقام. فأنا ما وقت تقول لي الرقم اللي قلت لك هو، قول لي الرقم اللي قبله. جميل. فلما أقول 1 ما حتقول شيء، بعدين حقول 2 حتقول 1. جميل. All of these are tests of attention, really. They assure me that Yusuf is not rehearsing the 5 words that I've taught him. So you can add these tests that we've just demonstrated to your tests of attention. Spelling a word backwards, this is called the N-back test. So 9 7 8
7
5
8
14
5
3
14.
Very good. Do you remember the 5 words? فاكر ال5 كلمات اللي قلناها؟
أذن قطن مستشفى مدرسة شجاعة.
Very good. So people tend to wait for at least 5 minutes. Depends on the level of distraction you've given people. Sometimes people wait for 10, 15 minutes. Because really, it depends. The literature is broad on this, and depends on what type of test you're using. But waiting for 5 to 10 minutes is good. And another way to test memory is to ask a person about memories of past events that happened in their life, or past events that are known, common knowledge. So, for example, يوسف، إيش كان عندكم محاضرات اليوم؟
كان عندنا محاضرة من الساعة 9 ل10 في مادة النساء والولادة.
مين كان الدكتور؟
دكتور طارق عرب.
إيش كان موضوع المحاضرة؟
كان breach and malpresentation.
Okay. So this information is verifiable. So if Yusuf is in fact right, it means he was able to register the information and recall it back for me. There are other components of memory that we will not demonstrate for the purposes of this video. The cognitive exam in general is broader than this. We have already talked about multiple components: wakefulness and arousal, attention, language, and memory. And there are a number of other components of the